Why is suicide considered extremely wrong? There are religious and personal views as to why suicide is viewed wrong. Suicide is such a sensitive subject that this is why people do not think about how it could help people who are terminally ill. It is frightening to think about a person taking their own life. So many people have deemed suicide wrong, but what about easing the pain of someone dying? If someone is on their deathbed in terrible pain, is it wrong for them to ask a physician for physician-assisted suicide? Their fate is already decided. There are no other options for life, but suicide is often looked at as self-murder. Physician-assisted suicide should not be looked at like murder, instead a way to help terminally ill patients. What is physician-assisted suicide? Physician-assisted suicide can be looked at like assisted dying. Assisted suicide is suicide with the aid of a physician. Theresa Yeo states, in each U.S. state that has legalized physician-assisted suicide, the law stipulates that it may be pursued only by terminally ill patients who have a prognosis of 6 months or less to live. When a patient expresses that they want to die with the help of a physician, they go through counseling. When they are deemed in the right state of mind, physicians can administer a means of death. Physician-assisted suicide should not be considered wrong because it helps the terminally ill. Theresa Yeo writes, several distinct justifications have been given in the push to legalize physician-assisted suicide. The rationale for legalizing physician-assisted suicide initially was allowed to doctors to end suffering of patients who were experiencing intolerable pain at the end of their lives. In recent years, emphasis has been placed on different reasons, patient autonomy, especially in the case of assisted suicide. There are two reasons: the avoidance of suffering and the exercise of individuals' autonomy are the primary justifications cited by advocates of assisted suicide. When my grandfather was dying of esophageal cancer, he was in so much pain that the morphine was not helping. He weakly asked my grandmother to help him die or to have a doctor help him. She did not answer him. Instead, she walked away. I could not help but to think that she had rather seen him in pain as he died than to consider physician-assisted suicide. He was dying, and there was no changing his outcome. He voluntarily expressed his wish to die, but because suicide is considered wrong, my grandma looked down, shunned, and deemed him weak for wanting to stop the pain. He did not want to end a life that he would continue to live. He wanted to end a life of pain, one that he would not be living much longer. After seeing how my grandmother looked at him, he did not bring it up again. I could see it in his eyes that he was suffering, but he knew that my grandmother's personal and religious views would not allow her to accept physician-assisted suicide. Most people deem suicide wrong because of religious views. According to the United Church of God, the Bible has examples of people committing suicide. The church states, while we find no commentary with these incidents, it's covered in principle in the Sixth Commandment. Suicide is an act of murder. While there can be no doubt that taking one's life is wrong, suicide is often a complex matter. Individuals who commit suicide often have been struggling with serious problems such as depression, alcoholism, or other forms of drug abuse. Taking one's life isn't the right way to deal with any trial, but the people who do are more likely not thinking clearly. Physician-assisted suicide should not be seen as murder. People serve a caring God, so why is easing a terminally ill patient murder? When a person is terminally ill, they are not using alcoholism, drug abuse, or mental illness as an excuse. They are dying from a disease and have no chance of getting better or living. I'm a religious person, but I believe physician-assisted suicide to be mercy killing. Religious and personal views make it hard for people to accept physician-assisted suicide. I love the God I serve, but I do not think physician-assisted suicide is murder. Physician-assisted suicide is a way to stop the pain of a terminally ill patient. I could not stand to watch my grandfather go through the pain he was suffering as he was dying. Physician-assisted suicide is mercy killing and should not be viewed as wrong or inhumane. Humans feel compassion, but they cannot bear to feel compassion for people who are suffering and want to die. Suicide is not normal, but it should not but it should not be deemed wrong for terminally ill patients.